and welcome to The Beat. I'm pleased to be sitting here with members of our pharmacy team, Jennifer and Tami. Welcome to the studio today.
Thank you for having us.
Thank you, Nick, for having us.
Yeah, I know, Jennifer, you've been on the show before, and it was awesome when you reached out and you wanted to talk about some other things the pharmacy team is up to with COVID-related care and pharmacy-related things with that, medication and things. But before we get into that, I'd love to have you introduce yourself again. And Tami, welcome for the first time too.
Thank you.
I guess I'll go first. So my name is Jennifer. I am the current PGY2 administration resident, pharmacy resident. And I guess I am the lead for this Test to Treat equity grant that I wanted to speak to everyone today about.
Awesome. Can't wait to get into that. And Tami, welcome.
So I'm Tami. I'm one of the pharmacists. Before this, I was actually at the mass vaccination site at the Fairgrounds Expo. So I've been there for the past 2 years. We finally closed the doors February 25th. It was very bittersweet, but I'm really glad to be able to see that to the end of the emergency declaration. But now I'm excited to join Jennifer and her team for the Test to Treat COVID program here.
Awesome. Well, thanks for all that you did. Everybody did at those mass vaccination sites and the mass testing sites. It was truly all hands on deck for all who worked at the county, especially here at the health and hospital system. And today, it's no different. We're still talking about COVID, but in a slightly different way, not necessarily the mass sites, but Test to Treat. What is that? And what are we going to be talking about today?
Yeah, so I guess I'll get started. So Test to Treat is the idea where patients who test positive for COVID can get access to treatment as soon as possible. This is really important for patients because patients who are symptomatic for COVID, they only have about a 5-day window from when they start feeling COVID symptoms that they can actually get access to oral COVID medication treatment. So this concept is basically once patient tests positive, make sure they get access to treatment as soon as possible. So that's kind of the inception of this grant by the California Department of Public Health. It's the COVID Test to Treat equity grant. And I want to highlight that this is making sure that patients get access to COVID-19 treatments as soon as possible as they test positive. So pretty much is to increase access.
So why is this 5-day window important, or what does that really mean for people who are testing positive? 5 days for what?
So the 5 days is actually from the onset of symptoms. So Pfizer did studies where if we were able to treat the patient with Paxlovid or Paxlovid within 5 days, there is about an 86 to 88% reduction of the symptoms and the duration of the of COVID. That's why we try to target the patient within the 5-day window.
Okay. So with this grant, and I know we'll get into the California Department of Public Health and this grant that allows us to offer this for Test to Treat. So before Test to Treat, which was kind of ideated here at Santa Clara Valley Healthcare, what were people doing before Test to Treat? How were they getting access to medications that were lowering symptoms, saving lives?
Yeah, so before patients who tested positive, they would have to usually follow up with their primary care provider. In some instances, they might not necessarily get a chance to get an appointment in a timely manner since, sometimes patients test positive and then they're not really sure, like, is this COVID? Is this a cold? And then they end up testing positive a couple days later, even though they felt symptomatic. So then this might make them fall out of this window of getting COVID treatment within 5 days of feeling COVID symptoms.
Can you talk a little bit about how this is paid for and a little bit more of the grant that I kind of touched on before, how this kind of was able to begin?
So we talked earlier about the California Department of Public Health, their Test to Treat equity grant. So we applied for the grant and we actually received $1 million from the state to increase access for patients. to get access to treatment as soon as possible. So everything related to getting the medications to the patients in a timely manner, anything with appointments, these are all free and paid for by the grant itself.
So Test to Treat is free to patients who are entered into the program. And so what is kind of the roadmap for people taking these medications? Not necessarily the specifics of the medications, but more so if it's going to be taken for a long time, for example, is it something that stays covered for the entire duration?
Yeah, so for outpatient patients, so patients who aren't hospitalized, there are 2 oral COVID antiviral medications. So I guess they are fighting against the COVID virus itself. So there's Paxlovid and then there's Molnupiravir. And these are both 5-day courses that patients will take. And it's more necessarily, instead of having like a long-term prevention of getting COVID again, it's to fight against the COVID that the patient currently has. And it prevents, reduces their symptoms and actually lowers their risk of getting hospitalized or pretty much reduces the risk of hospitalization. So it's pretty much preventing patients from getting worse with COVID when they have it.
Okay. So the medications have an effect on treating the actual symptoms of the COVID, but does it have any effect at all on immunity against COVID-19 when people are taking these medications for a case of COVID that they've already caught?
It's more for treating the symptoms and the duration of the COVID infection they have right now, the treatment. We still recommend patients still getting their COVID vaccine and their booster to build that immunity. So it's another step in the treatment of COVID is getting immunity with a vaccine. You still can get COVID, and if you do get the COVID, we will be there to help you with treatment to help reduce the severity and the duration of your symptoms.
Now, as far as the program actually kicking off, I know in our notes we've talked about various phases of the program itself beginning, phase 1, phase 2. I know that's vague, but can you explain how this program is kind of getting rolling?
To explain, going back, we actually rolled out the program in 2 phases. So phase 1 is we had the pharmacists refer all patients to a program called Sesame Care. So Sesame Care is like an online telehealth program that the state has partnered with to make sure that patients get access to treatment as soon as possible. So patients can book appointments for free online and get, when they see the provider, the state pays for that medication. Similarly, if they get oral COVID medication, the state is also paying for that. So we rolled the program in 2 phases. So that was phase 1. And then recently, as of early February, we rolled out to phase 2, where we've included the pharmacists being able to prescribe under protocol. So now that patients who call saying they have tested positive for COVID and they want treatment, the pharmacist is able to prescribe them actually Paxlovid or Molnupiravir under the protocol and get them access to treatment right away.
So it's wonderful that the team here at Santa Clara Valley Healthcare has really spearheaded this. And as far, I don't know if we've talked about already about patients who are sitting at home, they take a test, for example. Some people can often be scared. They don't know what to do. They don't know what they can expect when it comes to the actual effects of COVID-19 on their body. How do people make sure that they get the right treatment or get connected with this program, Test to Treat?
I think that's the most important thing. Patients who test positive, like you said, they may be feeling scared. They don't know what to do. So this program is really to build out awareness for patients so they get access or connected to a provider or a pharmacist right away so they get treatment. And then we're there for them every step of the way. We walk them through the whole process. We counsel them on their medications, on how they should take the medication, any side effects, if they're taking other medications, any counseling points. So for patients who are feeling scared, we are there for them and we will walk them through every step of the way and, even follow up with them afterwards, being like, hey, so, you finished your course. How are you feeling? Is there anything we can do to help you further?
They can also give us a call at our Test to Treat program. Our number is 408-793-7440, or even going on the web at the Santa Clara County website and look under the Test to Treat program. All of the links and phone numbers are on there as well.
All right. And I had a question actually about people actually receiving these medications, getting connected with the program, and then actually getting connected to receive treatment. Is it always people who get COVID-19 and then actually have symptoms, or are asymptomatic people also recommended to get connected with the Test to Treat program?
Yeah, so for the oral COVID-19 medications, they are more for helping with the symptoms and reducing the risk of hospitalizations. But of course, if, patients are feeling asymptomatic, they can still talk to us because, our pharmacists are very well equipped to help them with, other questions they might have. Like a lot of times patients have questions about like isolation, like when should I test again? When is it okay to go back to the public? So even if patients test asymptomatic, they can still give us a call and we can help, answer any other questions they have related to COVID-19 itself.
I know you mentioned a phone number. We'll make sure to put all of the information on screen and as well in the show notes to make sure people can get connected with these services if they need it, or just to be aware. So if they ever do come across a positive COVID-19 test, that they know where to go and where to look for. Is there anything else as far as program goes before we kind of get into more of the specifics, how to get connected and so forth, that we should know about this program itself?
Yeah, I think I want to emphasize our kind of mission, because our mission is very aligned with Santa Clara Valley Healthcare. Our mission is better health for all. So I think that this program is like a supplemental. It's adding on, and its belief to make sure that all COVID-19 patients actually get better help and make sure that they get the access they need that they are looking for.
Awesome. Anything else to add to that, Tami?
I'm so proud to start working with Jennifer and our director of pharmacy, Narinder Singh, on this program, because I feel like we didn't have such easy access before this program started. So yes, thank you to Jennifer for giving me this opportunity to join her team.
That's wonderful. Again, I think you're right. It so much aligns with Santa Clara Valley Healthcare's mission, better health for all. And this is just another example of the way that is carried out. And for information, for people to get connected, can we say the phone number and the website again? We'll make sure to put in the show notes and any other information relevant for people to know how to access.
Yeah. And it was funny because I have actually everything written here on my little Post-it note.
Yeah, let's hear it.
Our phone number is 408-793-7440. We are open Monday through Friday, 9 a.m. to 6:30, Saturday and Sunday, 9 a.m. to 5 p.m. We're open all 7 days of the week. We are even open on holidays, especially that's when I feel that COVID-19 patients need access to treatment the most. So for example, on New Year's Day, I was working, making sure all patients get connected to treatment as soon as possible. And for more information, our website is www.sccgov.org/T2T.
Wonderful. Anything else before we head out today? This has just been a wonderful time getting more information about just another great service spearheaded again by the professionals here at Santa Clara Valley Healthcare.
Thanks for having us on your show and for helping us get the word out.
Yeah. So thank you for having us. I think that our real mission is that we wanted to get the word out to patients on how wonderful our care is at Santa Clara Valley Healthcare, and making sure that patients know of this program and making sure they get access to treatment as soon as possible.
Absolutely. Well, Jennifer and Tami, we thank you again for sharing that information with us today. Again, a great service. People definitely need to know because, again, COVID-19 gone in a lot of ways, here in a lot of ways. So, again, this is just super helpful for so many people to know. And, again, to you and all the team there at Pharmacy, thank you for joining on The Beat today.